6:47 in the morning. Your alarm goes off. You slept badly. You reach for your phone, check the time, swing your legs out of bed, and within 90 seconds, you are standing in the kitchen pouring coffee. In that minute and a half, your heart rate jumped from 55 beats per minute to 90. Your blood pressure spiked by 20 to 30 points. Your blood, thickened overnight from 7 hours without a single sip of water, is now being forced through vessels that have not yet opened up, and you felt absolutely nothing. Here is what nobody tells you at your annual checkup. The most dangerous window for a heart attack is not during exercise. It is not during a stressful meeting. It is the first 60 to 90 minutes after you wake up. Cardiologists call this the morning surge. Research shows that heart attacks happen 40% more frequently between 6 o'clock and 10 o'clock in the morning than at any other time of day. That is not bad luck. That is a predictable cascade of physiological events that most people trigger every single morning without knowing it. What you are about to hear is the clinical reality of how your cardiovascular system behaves in the morning, why certain daily habits turn that vulnerable window into a dangerous one, and what you can do starting tomorrow to protect yourself. 15 years of practice, I see this pattern destroy lives that did not need to be destroyed. Subscribe and hit like right now. What I am going to explain in this video, nobody is covering at your next appointment. The system profits when you come back for another prescription, not when you understand how your own heart works. To understand why mornings are so dangerous, you need to know what your body does while you sleep. During the night, your nervous system shifts into what is called parasympathetic mode, the rest and repair branch. Heart rate slows, blood pressure drops, blood vessels relax and widen. Cortisol, your primary stress hormone, falls to its lowest level. This is your cardiovascular system's only real recovery window in the entire 24-hour cycle. Then the alarm goes off. Within seconds, the opposite branch takes over. The sympathetic nervous system, your fight-or-flight system. Cortisol surges. Adrenaline, also called epinephrine, floods the bloodstream. Heart rate accelerates. Blood vessels constrict. Blood pressure climbs fast. At the exact same time, your blood has been thickening all night. You have not consumed water for 6 to 8 hours. Red blood cells are more concentrated. Platelets, the tiny cell fragments responsible for forming clots, become stickier and more likely to clump together. Doctors call this increased platelet aggregability. In plain terms, your blood is in its most clot-prone state of the entire day. Now combine those two realities: constricted vessels, surging pressure, and thick, sticky blood. If you already have a narrowed artery, a plaque sitting quietly on the wall of a coronary vessel, that morning combination is exactly what can crack the plaque open and trigger a clot that blocks the artery completely. That blockage is a heart attack. This is not rare. This is the single most common timing pattern for myocardial infarction in the cardiology literature, and the habits you perform in that first hour either protect you or push you closer to that edge. By the way, a lot of you have already been checking out Care Health, the link on my channel page. If you have not looked at it yet, do that. Now let me walk you through exactly what those dangerous morning habits are. The first dangerous habit is the one almost everyone does. The alarm rings, feet hit the floor, and you are vertical within seconds. It feels normal. It is not. From a cardiovascular standpoint, this is one of the worst things you can do during the morning surge window. Here is what happens inside your body. The moment you go from lying flat to standing upright, gravity pulls roughly 500 to 700 milliliters of blood downward into your legs and abdomen. That is more than half a liter of blood that your heart was relying on suddenly gone from circulation. Your heart now has less blood returning to it. To compensate, it beats faster and constricts blood vessels to force enough pressure up to your brain. This is called orthostatic stress. In a young person with elastic vessels, this adjustment happens smoothly. You stand, the system recalibrates in seconds, and you feel nothing. After 40 or 50, the picture changes. Your vessel walls are stiffer. Your baroreceptors, the pressure sensors located in your neck arteries that detect changes and tell your heart how to respond, react more slowly. The adjustment becomes rougher. Blood pressure can spike sharply or dip dangerously low before stabilizing. Either extreme puts strain on vessels that are already under morning surge pressure with thickened blood running through them. The fix costs you exactly 1 minute. When you wake up, do not stand. Sit on the edge of your bed for 60 to 90 seconds. Flex your ankles up and down. Squeeze your calf muscles a few times. Take several slow breaths. That brief pause gives your baroreceptors time to calibrate, your vessels time to adjust, and your heart time to shift from sleep mode to waking mode without being ambushed. 1 minute. That is all it takes to remove this risk entirely. The second dangerous habit. You survived getting out of bed, walked to the kitchen, and the first thing that enters your body is coffee. Not water, not food, coffee. Millions of people do this every single morning, and from a cardiovascular standpoint, the timing could not be worse. Two mechanisms hit simultaneously. First, caffeine is a vasoconstrictor. It narrows blood vessels. During the morning surge, your vessels are already constricted from the cortisol and adrenaline that flooded your system the moment you woke up. Adding caffeine on top tightens them further. Blood pressure climbs even higher than the surge alone would produce. Second, caffeine directly stimulates your adrenal glands to release additional cortisol. You are now stacking stress hormone on top of stress hormone during the exact window when your cardiovascular system is already under its peak strain of the entire day. Now add the dehydration factor. Your blood has been thickening for 7 hours. You have not consumed a drop of water since before you went to sleep. Coffee is a mild diuretic, meaning it increases urine output, so instead of rehydrating your system, you are actively pulling more fluid out of it. Thicker blood, narrower vessels, higher pressure. That is the equation that makes cardiologists uncomfortable. The solution is not to give up coffee, it is to change the sequence. Drink a full glass of water first. Eat something, even something small, a banana, a handful of nuts, a slice of bread. Then have your coffee 30 to 45 minutes after waking, once your cardiovascular system has already transitioned out of the surge window and your body has had a chance to rehydrate. That single change in order dramatically reduces the strain on your heart and your vessels. Same coffee, same morning, completely different level of risk. The third habit is the one that shocks people the most because it sounds like a contradiction. Exercise is supposed to protect your heart, and long-term, it absolutely does. But intense exercise, first thing in the morning, before hydrating, before eating, before your cardiovascular system has fully transitioned out of sleep mode, is a documented trigger for cardiac events in people with existing coronary artery disease they do not even know about. Here is the physiology. Intense exertion demands a massive increase in cardiac output. Your heart needs to pump 4 to 5 times more blood per minute than it does at rest. Every coronary artery, the small vessels that feed your heart muscle itself, must deliver dramatically more oxygen to keep up. If one of those arteries is already partially blocked by a plaque, the increased demand can outstrip the supply. The heart muscle downstream of that blockage becomes ischemic, meaning it is starved of oxygen. Now add the morning surge conditions: thickened blood, sticky platelets, elevated pressure. If that plaque is unstable, the shear force from high-velocity blood flow can literally crack its surface open. Platelets rush to the crack, a clot forms within minutes, and the artery closes. That is a heart attack triggered by the very activity you believed was protecting you. The exercise itself is not the enemy, the abruptness is. If you exercise in the morning, start with 10 to 15 minutes of gentle movement first, walk slowly, stretch. Let your heart rate rise gradually, instead of forcing it from resting to maximum in seconds. Drink a full glass of water before you begin. Eat something small, a banana, a handful of nuts, anything to stabilize blood sugar and signal your system that the day has started. Then train. That 15-minute buffer between waking and intensity is not wasted time. It is the difference between exercising safely and gambling with a system that was not ready. The fourth habit is one most people never connect to heart attacks: sleeping fewer than 6 hours per night on a regular basis. During deep sleep, your cardiovascular system gets its only genuine rest period in the entire 24-hour cycle. Heart rate drops to its lowest point, blood pressure falls, the endothelium, the microscopically thin inner lining of your arteries, undergoes active repair, inflammatory markers in your blood decrease. Growth hormone is released, which aids tissue repair throughout the body, including the heart muscle itself. Deep sleep is not downtime. It is the maintenance window your heart depends on to stay functional. When you consistently cut sleep short, you rob your cardiovascular system of that window. Cortisol, which should drop overnight and give your vessels a break, stays elevated around the clock. Baseline inflammation rises. C-reactive protein, a blood marker that measures systemic inflammation, is measurably higher in people who regularly sleep fewer than 6 hours. And chronic inflammation is not a vague wellness concept. It is the specific biological engine that drives plaque formation inside your arteries, the same plaques we discussed earlier, the ones that sit silently on a vessel wall for years and then rupture one morning when the conditions are right. Large population studies tracking people over years consistently show that those sleeping fewer than 6 hours per night carry a 20 to 30% higher risk of heart attack compared to those sleeping 7 to 8 hours. That is not because tired people make bad decisions. That is cumulative vascular damage from inadequate recovery, compounding night after night after night. The takeaway is not complicated, but it is hard for many people to accept. Sleep is not optional. It is active cardiovascular maintenance. Cutting it short to be more productive is borrowing time from your heart, and the interest rate on that loan is brutal. The fifth habit is the one people dismiss fastest: chronic unmanaged emotional stress. Explosive anger, sustained anxiety, the kind that tightens your jaw, clenches your fists, and sits in your chest like a weight for hours. Here is what happens inside you during those moments. When you experience intense anger or anxiety, your sympathetic nervous system fires hard. Adrenaline and noradrenaline flood the bloodstream. Heart rate can spike to 120 to 150 beats per minute within seconds. Blood pressure can jump by 40 to 60 points. Coronary arteries, the vessels feeding your heart muscle directly, can actually spasm and temporarily narrow under intense sympathetic stimulation. Your heart is simultaneously being asked to work harder while receiving less blood. That is not a sustainable equation. In extreme cases, this produces something called stress cardiomyopathy, also known as Takotsubo syndrome, sometimes called broken heart syndrome. The left ventricle, the heart's main pumping chamber, literally balloons outward and changes shape. The pumping action weakens dramatically. The patient arrives at the emergency room with symptoms identical to a heart attack. This is not a metaphor. This is a real, documented, potentially fatal cardiac event triggered purely by emotional overload. Most people will never experience that extreme, but most people experience small to moderate stress spikes dozens of times per day. Traffic, arguments, work deadlines, financial worry, each one triggers a smaller version of the same cascade. Elevated heart rate, constricted vessels, stickier platelets. Individually, each spike is survivable. Cumulatively, over years they accelerate endothelial damage, promote plaque instability, and prime the entire system for a major event. Stress management is not a luxury. It is not a wellness trend. It is cardiovascular protection. 5 minutes of deliberate slow breathing measurably reduces sympathetic activation and lowers cortisol. Walking outdoors activates the parasympathetic system. These are not soft suggestions. They are interventions with documented effects on arterial health. Now I want to pause the habit list and make sure you understand exactly what is happening inside the organ we have been talking about. Because most people have never been shown how a heart attack actually works mechanically. And without that picture, everything I have said stays abstract. Your heart is a muscle, and like every muscle in your body, it needs its own blood supply to function. That supply comes from the coronary arteries, small vessels that sit on the surface of the heart and branch inward, delivering oxygen and fuel to every region of the heart muscle. There are two main coronary arteries, left and right. They divide into smaller branches. A blockage in any one of those branches starves the region it feeds. Starved heart muscle dies. That is a heart attack. Here is how a blockage forms. It starts with damage to the endothelium, the inner lining of the artery we have discussed multiple times now. Once that lining is scratched or inflamed, LDL cholesterol, what most people call bad cholesterol, begins to infiltrate the vessel wall. White blood cells follow, trying to clean up the cholesterol. They become engorged with it, forming what pathologists call foam cells. Over years, these foam cells accumulate. A fibrous cap forms over the deposit. You now have a plaque. Here is the part that saves lives if you understand it. There are two types of plaque. A stable plaque has a thick cap. It narrows the artery gradually. You might feel chest tightness during exertion. An unstable plaque has a thin, inflamed cap. It may barely narrow the artery at all, which is why it produces no symptoms. But when that thin cap ruptures, platelets swarm the site, a clot forms within minutes, and blood flow stops completely. Most heart attacks come not from the biggest blockages, but from smaller, unstable plaques nobody knew were there. That is why people say, "But he was healthy, he had no symptoms." The plaque was there. It was just silent until it was not. Your body does not go from perfectly fine to heart attack without warning. In the majority of cases, it sends signals days or even weeks before the event. The problem is that almost nobody recognizes them for what they are. The first warning is unusual fatigue, not tiredness from a bad night, a deep, heavy exhaustion that does not improve with rest, the kind where climbing a flight of stairs leaves you winded in a way it did not 2 months ago. This happens because the heart is struggling to maintain adequate output. Blood flow to your muscles and organs is subtly reduced. Your body compensates by dialing down energy availability across the board. People blame it on age, on stress, on a busy week. It is none of those things. The second warning is chest discomfort. That is not sharp pain. People expect a heart attack to feel like a knife in the chest. In reality, the early signal is often a vague pressure, tightness, or squeezing in the center of the chest that comes with exertion and fades with rest. Doctors call this angina. Most people dismiss it as indigestion, muscle strain, or anxiety. The third warning is referred pain. Discomfort in the jaw, left arm, shoulder, upper back, or even the teeth. The heart shares nerve pathways with these areas. When the heart is in distress, the brain sometimes misinterprets the signal as coming from a neighboring region. A man ignores a sore left arm for 3 weeks. A woman dismisses jaw pain as a dental issue. These are documented patterns. The fourth warning is shortness of breath, without obvious cause. Distances that used to be easy now leave you breathing hard. Lying flat at night feels like you cannot get a full breath. That points to a heart that is not pumping efficiently enough to keep the lungs clear. The fifth warning is cold sweats and nausea out of nowhere, especially during or after mild exertion. Your autonomic nervous system firing distress signals. If any of these are new and appeared in the last days or weeks, do not wait. Do not monitor it. See a doctor. Most people assume their annual physical covers the heart. It does not in any meaningful depth. Here are the 5 tools a cardiologist actually uses and why each one matters. First, a resting electrocardiogram, or ECG. This records the electrical activity of your heart and can reveal rhythm abnormalities, signs of previous damage, or areas that are not receiving adequate blood flow. It takes minutes, and it is painless, but it has a significant limitation. It only shows what the heart is doing at that exact moment while you are sitting still. That is why the second tool exists, a stress test, also called an exercise ECG. You walk on a treadmill while your heart rate, blood pressure, and ECG are monitored under increasing workload. This exposes blockages that only produce symptoms when the heart is working hard. A resting ECG can look perfectly normal, while a stress test reveals the problem hiding behind it. Third, an echocardiogram. This is an ultrasound of the heart. It shows how well the chambers are pumping, whether the valves are functioning correctly, and whether the heart muscle has thickened or weakened. It gives a live, moving picture of your heart at work. Fourth, blood tests beyond the standard cholesterol panel. High-sensitivity C-reactive protein, or hsCRP, measures vascular inflammation directly. Lipoprotein A, written as LPA, is a genetic risk factor for plaque formation that standard cholesterol tests do not capture. Many people with normal cholesterol have elevated LPA and have no idea because nobody tested for it. Fifth, coronary calcium scoring, a specialized CT scan that measures calcified plaque in your coronary arteries. It takes minutes, requires no injection, and gives a numerical score that directly correlates with your heart attack risk over the next 5 to 10 years. A score of 0 is highly reassuring. A score above 100 demands immediate attention. Here is the critical point. Most of these tests are not part of a routine annual physical. You have to ask for them, and asking is not being a difficult patient, it is being an informed one. Now let me bring everything together into a single, clear protocol you can start tomorrow morning. When your alarm goes off, do not stand. Sit on the edge of your bed for 60 to 90 seconds. Flex your ankles, squeeze your calves, take several slow breaths, then stand. Walk to the kitchen and drink a full glass of room temperature water before anything else touches your lips. Eat something small, wait 30 minutes, then have your coffee. If you exercise in the morning, begin with 10 to 15 minutes of gentle movement. Walk, stretch, let your cardiovascular system warm up before you ask it to perform. Throughout the day, do not sit for more than 60 minutes without standing and moving for at least 2 to 3 minutes. Prolonged sitting slows circulation and increases clot risk. When you feel stress building, stop and take 5 slow breaths. In through the nose for 4 seconds. Hold for 4 seconds. Out through the mouth for 6 seconds. This is not meditation. This is a direct physiological intervention that reduces sympathetic nervous system activation and lowers cortisol in real time. Evening. Eat your last meal at least 2 to 3 hours before bed. A heavy late meal diverts blood to the digestive system and stresses the heart during the transition to sleep. Avoid alcohol. It may help you fall asleep, but it disrupts deep sleep, elevates resting heart rate, and dehydrates your blood overnight, setting up a worse morning surge the next day. Sleep. Aim for 7 to 8 hours. Dark room, cool temperature. No screens for 30 minutes before bed. Consistent sleep and wake times. This is not lifestyle advice. This is cardiovascular maintenance. How old are you? Write it in the comments. I want to know which age group this is landing with, because it changes which risk factors matter most and which tests you should be asking about first. That will shape what I cover next. Everything I have explained today, the morning surge, the 5 habits that trigger it, silent plaque buildup, the warning signs your body sends, all of it leads to one unavoidable conclusion. You cannot protect yourself from what you do not know about. And the problem is, the standard 12-minute doctor's appointment is not built to uncover what is hiding in your cardiovascular system. It is built to manage what already went wrong. That is exactly why I want to talk to you about Care Health. It connects you directly with clinical trials and advanced cardiovascular screening programs in your area, not experimental unknowns, real cutting-edge monitoring and early intervention options, the kind of care that never makes it into a standard office visit. You get matched based on your specific health profile, your age, your risk factors, your location. It is personalized, it is thorough, and it is completely free to sign up. This is currently available exclusively to U.S. residents. If you are watching from the United States, you have access to something millions of people in other countries simply do not. Thousands of viewers from this channel have already signed up. I hear from them every week. People who discovered a condition they had no idea about. People who got into a monitoring program that caught something early. Spots in these programs fill up. Clinical trials accept a fixed number of participants, and once enrollment closes, it closes. Here is how to get in. Click the link on my channel page. If you are on your phone, tap my profile picture at the top of this video to go to the channel page where you will see the link. A screenshot is appearing on screen right now, showing exactly where to find it. If you are on a TV or computer, scan the QR code on screen. Open your phone camera, point it at the square, and tap the link that pops up. It takes 30 seconds. Do not be the person who watches this, nods along, and does nothing. Information without action is just entertainment. You now know what your heart goes through every morning. You now know what silent plaque looks like. The next step is making sure someone with the right tools is actually looking at yours. This will not be available forever. Programs close, trials fill, the window shuts. If you are in the US, take 30 seconds right now. The link is on the channel page. The QR code is on screen. Do it now, because the moment you scroll away, life takes over and you forget. And forgetting, when it comes to your heart, is not something your body can afford